The other issue has been insurance coverage. There was a survey by a marketing sort of communications company showing among academic medical centers, community and commercial payers, and really trying to identify barriers to NGS as a top barrier to next generation sequencing testing. In March of 2018, Medicare announced coverage of next generation sequencing for patients with cancer as part of their national coverage determination. This was for all patients with cancer, not just specifically for non-small cell lung cancer. But I think some of these efforts might be needed in order to make sure that cost doesn't become a barrier to biomarker testing. So potentially national coverage determination and other such advocacy, and other such efforts through advocacy may be potentially a solution to the cost barrier for biomarker testing. There was this study which was conducted in 2021, almost 2 to 3 years after the NCD was announced. And it did show that the percentage of patients receiving next generation sequencing testing within 60 days here for non-small cell lung cancer patients, this is pre the coverage determination announcement, and post coverage determination announcement, we do see there is an increase. It's still at 45%. Again, we need it to be higher, but this potentially could be one of the solutions to, again, broadening access to testing. The other interesting thing that this particular study demonstrated was, with the coverage determination being just for Medicare, there was quite a significant increase in NGS testing for patients who have Medicare-based insurance, and there were increase in NGS tests even for patients with commercial insurance, but not so much for patients who were in state Medicaid programs. So again, this sort of Medicare-based policy or national policy may be helpful in general, but still may widen gaps and disparities based on the patient's insurance type. So again, this may not occur equally across all insurance types. And again, further efforts beyond coverage policies are needed to ensure equitable access to the benefits of precision medicine and eliminating cost as a barrier to biomarker testing.